At NorthShore, it's more than a job. It's a passion. It's a purpose. It's a mission. Employees who are passionate about the work they do result in patients that are passionate about their health.
Working at NorthShore, it is very mission driven. Another key component to what I get to do is the big events for NorthShore. NorthShore actually have community events that are absolutely free. People get to come, they get blood screenings, they get to do blood pressure checks. And a lot of people, they always say, is this free? They can't believe it. But it is a service that NorthShore provides to the community, which is a part of our mission. Giving back to the community is another big part of what I get to be a part of at NorthShore. And I absolutely love it.
I'm from Northwest Indiana. I'm born and raised here. I was born to a single mom. And so I think with that comes a lot of struggles, which I know a lot of people live through that. I've seen people live through that. So it's hard in itself. And then there was also a stint where we lived in a transitional housing, so like a homeless shelter for a small period. And I think as a child, you don't understand how significant those things are. But then when you get older, you realize how many people and programs are in place that made sure you didn't fall through the cracks and you were able to get whatever you needed to be who you wanted to be and live to your full potential. And so I think here at NorthShore, that's the biggest piece that resonates with me in my heart is we're here for that. We want to make sure no matter what you need, if it's you just have a stuffy nose and you can't leave work, so we have after hours care, or you don't know how to get control of your diabetes because you think it's too expensive to eat healthy, like we're here for whatever that is.
What drew me to a place like this is my upbringing. So I grew up in a family of 12. And growing up in a family of 12 to foreign parents, to a foreign town, foreign country, they didn't really have access to healthcare or insurance or any access to anything really. So when they came to town, the first healthcare site was NorthShore Health Centers. And when they came here, they, again, didn't know the language, didn't have access to any care or any insurance or way of getting access. And NorthShore helped them do that. And since a kid, I've been coming to NorthShore myself as a patient. It was always my goal to work in healthcare. I never thought I was going to be at NorthShore until my dad encouraged me to apply because he saw how great they treated us. So he said, and I became an RN. So he said, try NorthShore. And I sure enough applied. And when I got the job, it was a big deal. It's important because of the communities we serve. Being on the other side of the mission, now I see how impactful we are actually to our communities, especially knowing both sides of the mission. I applaud it.